So the Micro-credential actually started about 4 years ago when I led a pan-European project which really sought to change outcomes in maternity care, particularly around women's experience of birth and the psychological consequences. So we know that approximately 30% of women describe their birth as traumatic, and anything up to 8 or 10% can go on to develop post-traumatic stress or post-traumatic stress disorder. And so we worked on that project for 4 years and reached the conclusion that one of the things that was absolutely necessary was an interdisciplinary training program for healthcare professionals working in maternity care. The reason it's needed right now is we know that anything up to 30% of the women who go through our maternity services in any 1 year will experience birth from a psychological point of view as traumatic. And bear in mind, we've almost 60,000 births a year just in Ireland alone. And as many as 1 in 5 have had a traumatic event in their life prior to becoming pregnant or accessing maternity care. And those women can be triggered even further just by the birth experience and by their interactions with caregivers.
I think we've started to understand how important delivering trauma-informed care is, and just understanding that the care we provide can be traumatizing for people, but also that people who previously have trauma from earlier in their life can be really impacted by their interactions with health service. And as we understand that more and more, we want to deliver care that supports those people and doesn't do anything to re-traumatize them. People who attend this course will have a much greater understanding of the role that trauma can play as people navigate the health service. For some people, that will be understanding how interventions that they're having can be traumatic, but others it will be how trauma that they have had previously in their life will be traumatic. And I think if healthcare providers are trained in this area, they will be able to minimize the traumatization that people experience, not just directly, but through impacting the institutions that they work in. That they will be able to bring the trauma-informed care principles to bear in the institutions where they're working.
So one of the ways taking part in this micro-credential will actually benefit you as a candidate on the course is through learning about birth-related trauma quite specifically and in a different way from perhaps how you've studied psychological care or psychiatry even in your past training. A critical issue for us is the fact that you will start to learn about the etiology, about the risk factors, but in particular, we're hoping that you will develop not just new knowledge, but skills and competencies in how to look after these families who are in your care.